Hello, ladies and gentlemen. We are back with part 4 of chapter 8. This is a big chapter. As you know, lots of PowerPoints, lots of pictures, lots of information. So as always, shoot me an email if you have any questions. Moving on to part 4, disorders of the ovaries. So these issues can be benign or malignant. We can have cysts, for example, which are benign, or we could have cancer, which we'll talk about closer to the end of this chapter, which is very difficult to find, so usually it's progressed by the time it is found, unfortunately. They both can affect that hormonal balance, since in females, the primary place we get our female hormones are from the ovaries. So we're going to talk about ovarian cysts, and that's pretty commonsensical, isn't it? Those benign fluid-filled sacs. And they can form during the ovulation process, then can rupture, causing discomfort, bleeding, and loss of menstruation. You can have excessive bleeding or loss of menstruation. It can go either way. But one more intense form is polycystic ovary syndrome, and this is when there's numerous cysts. And this can be caused by an endocrine abnormality, but it can also cause endocrine abnormalities because the cysts will take over the hormonal making tissue of the ovaries. So this can lead to infertility, loss of menstruation, and male type symptoms in a female, such as growing hair, hirsutism, getting more acne, and getting male pattern baldness. All right, so that is, from what I understand, also very uncomfortable with some females with polycystic ovary syndrome. Disorders of the breast can be benign or malignant, and obviously malignant would be breast cancer. We're going to look at that towards the end as well. We've lumped the cancers all together. Either or obviously could affect lactation, breastfeeding, and self-image. You know, females that have lumpectomies or mastectomies, it's very, very difficult for them. Examples that we're going to talk about that are non-cancerous are fibrocystic breast disease and mastitis. I'm going to kind of fly through these because my guess is you know quite a bit about these. And fibrocystic breast disease is scary because women find a lump, but then it's good because it's not cancerous, although they can be painful, especially during menstruation. They feel like that firm, movable mass, and they can be more frequent during childbearing years because they do respond to that waxing and waning of hormones. And as the hormones start to decrease and even off, reaching towards the end of childbearing years and into menopause, those cysts can actually decrease in size. So this is a familial history issue. Could be a high-fat diet, excessive caffeine intake, and sometimes it just happens. Mastitis, once again, this is probably bread and butter stuff, so I'm going to fly through this, is going to be a breast tissue inflammation associated with infection and with breastfeeding. Usually develops in those first 6 weeks of childbirth. This can be when a staph or a strep bacterium is introduced into the nipple. Somehow the usual barriers that protect the nipple and the breast are broken. Maybe a little micro cut, maybe a little tear, maybe the child is an aggressive nurser and has ripped some of the tissues, and that causes that infection to go in through the nipple and into the breast tissue. So this obviously can affect lactation, can cause abscesses, can be very painful with tenderness, swelling, redness, and warmth, exactly what you would expect in infections. So a patient has just found a firm, movable lump in her breast. She feels it does not require an ultrasound or mammogram. Let me know, this is new, and I put that in there, but you should know in this question, a new round, firm, movable lump. Should this patient follow up with her physician, true or false? Let me know what you think. Answer the question, and let's move on. So miscellaneous infections. Infections can manifest anywhere. So we're going to talk about some specific examples: prostatitis, epididymitis, candidiasis, pelvic inflammatory diseases. I haven't had enough caffeine yet. Here I go with my mouth again. All right, prostatitis is inflammation of the prostate. It can be acute or chronic. So anything that can trigger the inflammatory process can start this. It's more common in middle-aged men and those with a history of sexually transmitted infections. All your typical manifestations, pain and difficulty with urination, because remember the prostate goes around the prostatic urethra. So if it is swollen, it will push in on that urethra and it's difficult for them to urinate. They'll want to go more because they can't get it out. A lot more urination at night because once again, they can't get all the urine out at one time. And obviously they'll have pain in the abdomen, the groin, and the low back because that inflammation will push on the surrounding structures. Epididymitis is that comma shape, once again, that sits on top of the testes. And you could get an inflammation from this. It could be a bacterial infection from the penile urethra and up, retroacting back in through the system and through that reproductive aspect of their system. Or this can be from a sexually transmitted infection. It could be catheterization, sexual intercourse without using protection. Right, and this can, if it is not caught, although quite often if a male gets this, they will have a swollen scrotum and swollen epididymis inside of that. You know, obviously someone would be aware of that and not happy to have that. So males don't usually put off getting this treated if they feel that. I suppose it could be small enough not to be felt, but for the most part, it'll show indicators of infection. If it is left to go, is my point, it can lead to infertility and chronic epididymitis. Candidiasis is a yeast infection. This is by Candida albicans. Now, this is an opportunistic infection. So people who have a strong immune system can fight this off. People who don't can get this. You can just get this also. People who are diabetic are unfortunately prone to this because they tend to have more systemic glucose, and this yeast likes to feed on the glucose. This is most prone to show up in the vagina, causing vaginitis, which is an inflammation of the vagina, and it's also very uncomfortable for a female. Antibiotic therapy can also cause this. If you take antibiotic therapy, the antibiotic doesn't know good from bad bacteria, and it can kill off the good bacteria in the vagina. We do have a couple hundred strains of bacteria in the vagina, which keeps it healthy. So a woman, after she has antibiotic therapy, can have a flare-up of candidiasis. So it's always good to suggest probiotics if they're going to take that. Bubble baths, especially if it has started, can perpetuate it. You know, douching, increased glucose I mentioned, in people who are diabetic. Not sexually transmitted, but males may develop mild symptoms. Those usually will develop without treatment. Females, it does not, unfortunately. It manifests as a thick white vaginal discharge, cottage cheese consistency, and there's a lot of edema, itching, and burning in the vulva and also around the vagina and the labia. Can mimic other vaginal infections, so you can always take a sample and test it if you think it's a communicable disease. Pelvic inflammatory disease is going to be an infection into the female reproductive system, which is going to usually be a bacteria ascending from the vagina. So this could be any transmissible way you can get this. It could be through intercourse, could also come from not cleaning yourself properly. It's not always an STI. Complications, if it is left to go, although it is most primarily from STIs, I should mention. If it is let to go, it can go right up through the uterus and into the fallopian tubes and out into the peritoneal cavity and cause inflammation in there. And if that is left gone long enough with PID, it can actually cause scar tissue in the fallopian tubes, leading to infertility. It'll lead to a lot of pain and tenderness in the pelvis, the lower abdomen, or the lower back. because there's inflammation in that area and discomfort, and also signs of infection such as warmth or a high temperature. Let's practice a little bit. I have a couple of small examples here. Take a minute out of those infections that we just looked at and let me know which one you think this is. So get yourself oriented first. Look at the anatomical structures. Bladder, excuse me. Here's the normal prostate. You can see how the urine, I like this picture actually. You could see how the urine can pass down through the prostatic urethra, and you could see how if it swells, it would push in on that. The other thing that I like about this picture, here is the seminal vesicle we've spoken about in reproductive. Here is the duct that it secretes some of that seminal fluid to. So that's a great picture for that. Let me bring it back out. And I want you to think, what do you think is the disorder on the right here out of what we just looked at? Yeah, inflamed prostate or prostatitis. Looking at the next one. So healthy is on the left. You can see the testes and that comma-shaped epididymis sitting on top of it, leading to the ductus deferens. On the right, we have inflamed epididymis, so epididymitis. It's also a good picture to look at the testicular artery here. And around it, we have the testicular veins, also known as pampiniform plexus. And the reason I'm pointing it out is because when we talked about those veins dilating and getting distended, and the blood pulling back into them, you can see how they surround that testicular artery. And the pampiniform plexus helps to draw heat from that to regulate the temperature in the testes. So varicoceles, when they're distended, blood stays there, it doesn't drain out, and it doesn't take the heat from that testicular artery to cool down the blood going to the testes. This probably looks familiar. You guys are like, I got this one, Candidiasis, right? And I put a picture of the mouth because I couldn't stand the thought of putting the other one in. Okay, so what do you think this might be? This may be a little exaggerated. Pelvic inflammatory disease. Okay. All right, excellent. Let's look at sexually transmitted infections. There's more than 30 different types. We're going to talk about bacteria, viruses, and parasites. Some can be transmitted from mother to child, and there are some things that can happen in the child if that is true. Some of these are able to be gotten rid of, especially bacterial. Others, such as viral, can last a lifetime. 3 are reportable to the CDC: chlamydia, gonorrhea, and syphilis. So let's start going through some of these. Bacterial STIs, we used to call them Ds, but I guess the book is calling it STIs at this point. We're going to talk about chlamydia and gonorrhea. I think there's a lot of similarities in how they present. And the way you would tell the difference is to take a sample and test it. So chlamydia trachomatis is the parasite that will be transmitted with this STI. It's the most commonly reported one, and it's sexual contact or from mother to child. And the issue with that is you can get conjunctivitis with the neonate. You could get PID, which can lead to the scarring in the fallopian tubes and infertility. This can cause epididymitis, prostatitis, can lead to infertility, which I just mentioned, and ectopic pregnancy. So symptoms are pretty self-explanatory: discharge, pain with urination, painful sexual intercourse, and especially if they know that their partner has it, that would be a Big lead in. So gonorrhea, Neisseria gonorrhea is the second most common STI, and this is also transmitted through sexual contact or from mother to infant. Very simple, similar presentations. Could be asymptomatic. I think that's more typical in males and females. There'll be dysuria, discharge, and also white blisters that will darken and then disappear. So that's one little difference between them. Chlamydia and gonorrhea present with similar signs and symptoms. I already gave you that answer, so Merry Christmas. All right, let's talk about syphilis. And syphilis had a downswing for a while, and from what I understand, there's an upswing, especially I've been told in nursing homes. That's what I've heard. So this is a multi-step process, and it's transmitted from contact. And the interesting thing with this is it's a little difficult to diagnose, so some people let it go until it's too late. And the problem with that is it's treatable with penicillin. So syphilis has some signs and symptoms that I'd like to go over, and hopefully they will give you the knowledge you need just in case somebody shows up with these odd signs and symptoms. Now, with the stages, primary syphilis presents with what's called a painless chancre. I do have a picture with that coming up at the site of contact. So that is going to be your number one characteristic that you'll think of with syphilis. The bacteria then becomes dormant, and the symptoms go away. May not test positive, so you'd have to repeat it at a later date, but they're still contagious. Secondary syphilis, this rash, so a non-bleeding, non-oozing, red-brown rash, I think is a really good main characterization for your secondary syphilis, okay? This will usually pop up 2 to 8 weeks after the first chancre forms, and then treatment in this phase can halt the rest of the symptoms in their tracks. And the interesting thing with this rash is it typically goes away without treatment. Bacteria becomes dormant again. If it continues, they move into late or tertiary syphilis. Gummas are the major characterization. And these gummas are non-cancerous growths from syphilis. And the problem with the gummas is they can destroy the tissue. So they're not cancerous. They don't spread out from where they are initialized, and they don't metastasize, but you can get multiple gummas in different areas of the body that actually destroy the tissues. Now, this can be up to 1 to 4 years after those secondary symptoms show up. This can lead to a multitude of issues. It can eat away at brain tissue, leading to dementia. It can damage the eyes, leading to blindness. It can attack the nervous system, leading to paralysis. Okay, you get the ideas. At this point, they would test positive for this. Okay. So let's practice some of those stages of syphilis. I know you haven't seen it yet, but if you were to guess about those stages, what would you think this is? Primary, secondary, tertiary, and what is it? It is going to be tertiary in those gummas. And there are some really, this is the least gross picture I could find from online. It's devastating. It damages the tissue like you just can't believe. Okay, this, I think everybody knows, is going to be primary syphilis. This is going to be one of those chancres. And what do you think this is? Composite tape if you need another minute. This is going to be secondary with that skin rash. Okay, so I've always found syphilis an interesting disease, because it's so hard to put your finger on, and it's so easy to treat. So let's move on to some viral STIs. Actually, I'm going to pause the tape and we'll make a short fifth tape, I believe, in the next group. So we will pick up here in the next video. Thank you so much. This is Dr. DeShavo. Let me know if you have any questions.